Well, as we all know, it is important to take care of ourselves, and when doing so, we certainly cannot forget our dental health, even during a pandemic. So joining us here this morning to talk preventative dental care at home, we have Karen Ward, president of the Rhode Island Dental Association, and Dr. Fred Hartman, an oral surgeon at Hasbro Children's Hospital and Rhode Island Hospital. Good morning, everyone.
Thank you.
Good morning.
Great to have you both with us. This is certainly a very important topic, of course. I am one of these people who is extremely fastidious when it comes to his oral health, so I certainly am on board with these topics, and we really need to get to them here today. First of all, Karen, you know, for people out there watching who are really nervous about going to the dentist overall, but especially during this pandemic, you tell us there's really no reason to worry, correct?
Correct. Dentistry is safe. Dentistry is always practiced at a really high level of infection control. Offices recently have made modifications based on guidance from the Rhode Island Dental Association to really create a safe environment. If you're going to the dentist now, you may notice some changes. You may notice other things that are sort of behind the scenes. One of the things is hand sanitizer is often readily available. You may also notice staff are wearing, face shields and N95 masks. Those are just a few examples of enhancements that have brought us through the pandemic safely. Dr. Hartman and I speak for the Dental Association in that we're really proud of our dental community for their commitment to patients' health.
Absolutely. You guys certainly at the forefront of this, making sure that your patients, that your entire staff, everyone is safe and taken care of. So there's really, like you said, no reason to worry. And Dr. Hartman, let's talk about the fact that, we really shouldn't put off dental care. A lot of people, I think, we get bogged down with our day-to-day lives. Oh, I'll get to it later. But this is really something that needs our attention right away, isn't it?
It's true. There's no need to delay any dental visit. You should think of it as no different than seeing your physician or your pediatrician. It's actually risky not seeing your dentist regularly. We want to prevent problems, catch them early, and keep them small. Don't just call the dentist if you break a tooth. Maybe that's how you did things in the past. But in the COVID world, protocols like Dr. Ward was mentioning that keep dental offices safe could result in a delay getting in and being seen. So it's important to get ahead of things, and see your dentist now. There's also increasing evidence of a connection between your oral health and your overall health. When you have oral pain, you don't get good sleep, your diet changes, you take a lot of medications just to cope, and none of this is good for your immune system. There's also long-term, lots of things we're actually seeing connecting poor oral health to bad control of diabetes, cardiovascular disease, and even complications during pregnancy. So in short, don't delay.
Yeah, there are so many reasons, the laundry list, if you will, as you just alluded to, of why we need to stay on top of this and get in there to have our dental health and oral health maintained. So, Karen, it is Children's Dental Health Month, of course. So let's talk about the youngsters out there, when they really should start going to the dentist.
Good question. That's actually the #1 question we get from expecting mothers is, when should I bring my child? The American Association of Pediatric Dentistry recommends that kids have their first dental visit at age 1. Starting early has shown it helps to create a comfortable environment. It allows for prevention, and it's actually shown a reduction in decay and emergencies. The theme for Children's Dental Health Month is actually all about water this year. And we've actually seen that with kids being home, there's been an increase in the number of cavities. Kids are grazing. They're not having the structured meals that they're used to. So Dr. Hartman and I want to remind those watching it's important to provide structured meals with healthy snacks. Sugar is a major contributing factor to the development of cavities. And water is a great alternative to the sugar that's present in juice, soda, and sports drinks. So if given a choice, choose water.
Yeah, some great advice for parents out there watching today. And finally here, Dr. Hartman, if folks out there are looking for a new dentist, how can they go about doing so?
Well, a good place to start is with your coworkers or family members. Who do they see? Who do they like? Who are they comfortable with? The American Dental Association, their website has a great tool. It's the Find a Dentist tool. It's easy to use, and you can locate a lot of quality dentists nearby. And one of the nice things about Little Rhode Island is you can actually call the Rhode Island Dental Association and talk to a person and have a conversation and really get pointed in the right direction to get things off.
Great stuff. Well, it's very rare that I can share this piece of information, but when I have two people on the show that are of your field, I feel like they'll be impressed. I've never had a cavity.
Wow.
Good job.
Well done.
We'll put the sound effects applause in later. Great to have you both here. Such an important topic, all kidding aside, and we really appreciate your time and for both of you being here to shed some light on it.
Thanks for having us.
Thanks very much. Our pleasure.
You bet. A real pleasure for us as well. If you guys out there would like to review this segment, everything you need to know is posted right now at Rhodeshow.com.